CLL or chronic lymphocytic leukemia is a type of blood cancer. It affects lymphoid cells. They are mature lymphoid cells. They are not immature cells like in ALL, acute lymphoblastic leukemia, where you see lymphoblast or immature lymphoid cells, and here there is accumulation of mature lymphoid cells. Lymphoid cells are very important for immune system. Patients with CLL get lot of mature lymphocytes, but as they are abnormal cells, their immune system goes down. It's the same story like other types of blood cancers. In majority of patients, we don't know why they get CLL, but sometimes we see patients with a family history, so there is a hypothesis it can come in families, and also patients who get exposed to high levels of radiation are believed to have CLL, though this is not proven beyond doubt. In majority of cases, we don't know why patients get CLL, but what we know is it is commoner in men, it is commoner among Caucasians. So there are certain indications to say there may be a reason, though we still don't know. Signs and symptoms of any leukemia depend on what other cells are affected. Now, when the leukemic cells proliferate in the bone marrow, normal cells get reduced in number. If red cells get reduced, they become lethargic, feel shortness of breath. If platelets are reduced, they can bleed or start bruising. They can present with what we call B symptoms. Those are loss of weight, night sweats and fever, and also sometimes patients come with the complaint of itching, particularly after hot showers, and also they can come with lumps and bumps. In lymphoid malignancies, they get enlarged lymph nodes, so patients can present with enlarged lymph nodes, so they might not know this is a lymph node. They will come with swellings in certain parts of the body. Also, a lot of patients can present with infections, though their lymphocytes are high. They are not normal or functional lymphocytes. Most of the patients get into problems with chronic leukemias due to infections, and CLL is not an exception. CLL patients can present with infections, or subsequently while on treatment or while not on treatment, they can get infections. CLL is diagnosed by looking at the blood picture or doing a bone marrow. The bone marrow can be subjected to various advanced tests. We use a technique called flow cytometry or immunophenotyping. On the CD markers, there is a CLL scoring system. It is called Maturatus scoring. So depending on the Maturatus scoring, we can diagnose CLL. And also patients with CLL can have enlarged lymph nodes outside the body or inside the body, so they will need sometimes scans to assess their internal organs. CLL is not a curable disease. Anyhow, a lot of CLL patients have reasonable quality of life, and also it is important to know not all the CLL patients will need treatment. Only a proportion of CLL patients will need treatment. So there is a proportion who will not need any treatment and will have the normal life expectancy. So it's important to see a blood cancer specialist who can assess the patient properly and decide for the need of treatment. So treatments are chemotherapy or chemoimmunotherapy only if it is indicated, only for patients who fulfill the criteria for treatment. And also there are newer treatments available now which does not belong to the conventional chemotherapy group. There are targeted treatment or small molecules we use in CLL treatment which does not cause the side effects of conventional chemotherapy.